So here we are. Good evening, everyone. Here's a little video to continue a bit of what we did last time. Regarding biotherapies, so we're continuing with one last capsule following a rather significant discovery, at least to tell you about this Pucma therapeutic coverage that I will elaborate on shortly. It is a completely innovative new biotherapy that I have been testing for 3 weeks with quite spectacular results, at least for me. And the fasters will be able to benefit from this new biotherapy at the next treatment, which will be in April. But before that, a few updates. The dry fasting retreats for this year are already quite full. So those interested in coming should not delay too much, except for the Mintenegro retreat, which is still far off. So there we still have plenty of space, but the other retreats are quite full. So those who might be interested in coming, I believe for the next retreat, I think there are 2 spots left. So those who might still be interested in coming in April, please come forward. There are 2 spots left. And after that, for the summer retreat as well, it's filling up quickly, so please come forward. So the new developments are that now dry fasting is evolving. We have really remained in an evolving way that we want to develop, always with this psycho-emotional approach, working on awareness, working on introspection, working on inner letting go. So here we have Christine, who also helps us in this area, yoga, of course. All the biotherapies we offer, in addition, the consultation aspect as well, the bioresonance that each faster can benefit from at the start of dry fasting, which is unique. There is no fasting center that provides you with a precise health assessment at the start of dry fasting. So we continue with this with a therapeutic approach as well, where people receive an assessment. And that's somewhat the idea now of empower people also, because dry fasting should not be seen as a miracle cure that heals everything, only for people to then return to their lifestyle as if nothing happened with junk food, and then they just do dry fasting to treat a condition and change nothing about what they were doing. So the idea is not at all that. The idea is now to be able to provide knowledge and techniques without getting too caught up in the mind, because too much mental focus during a fast is precisely about not letting go of the mind, holding on to things too much, wanting to understand everything, wanting to analyze everything, and then we put up a lot of resistance, and then we are not really in an inner liberation when we want to accumulate knowledge. There are people who think it's good to accumulate lots and lots of knowledge during a retreat, but that's not exactly what should be done. One should provide the minimum amount of knowledge to ensure one's safety, to understand the basics. But we are not here to give naturopathy lessons for 6 hours during a dry fasting retreat. It's not the point. It's not the goal. People on a dry fast experience fatigue that sets in over the days, and they no longer really want to hear theories. So it's mainly about being at the inner self, experiencing a dry fast. A long cleanse is more about internalizing. It's more about having an inner experience rather than accumulating mental knowledge. So the year 2024 will really be focused on giving things. So in the practical guide for fasting, where there is already a lot of information on all this recovery that we modify and refine over the courses and years, we are really not at all in the Russian model, where there are a lot of errors. I had to redo all this information that was incorrect about all the preparation, the recovery that was more in line with Europe. We had impossible mixes between dairy products, kefir that produce fruits, things like that, gluten, carbohydrates in recovery. We're no longer into that model at all. Russian model, so we really refined the preparation, refined it during the dry fasting. There's a whole process that we've refined and detailed with all the input from naturopathy and neuroscience. And then We really try to give autonomy afterwards so that people can implement new healthy lifestyle habits in their daily lives, both physically and mentally. And that's how we achieve results, and not see dry fasting as a miracle therapy where you just come to do your treatment and to heal. So the idea is to be able to sustain this dry fasting, sustain the effect of the treatment that lasts for weeks or even months afterward. So I received feedback from 1 or 2 people, even several people, who after 6 months still had the same energy. Excellent. There was really a powerful result. So there you go. So sustain and bring new things that people can follow in a feasible way and not get into dogmas and complicated stuff with diets that are too drastic, but rather to give some guidance so that people can make micro changes and then continue with short dry fasts, for example, and that they are given a therapeutic approach to work on their weak points and then to pinpoint where they need to go work, strengthen, and then still maintain a rhythm of cleansing waste and toxins, because that's really what causes us problems. So we need to empty the trash bins once or twice a year. We need to regenerate and renew ourselves. And on that subject, well, yes, I will still talk about myself in the next book. So the new book is almost ready, so it will also be translated into English, so I am very happy. There will be new things. It's a book that will complement the first one. There is a lot of information news. There are 200 pages. We really refined all the preparations. There are a lot of very practical details too. So if you have the information online and plus the first book plus the second book, you really have something quite complete and safe to undertake a fast on your own. Although when you are in a treatment center, everything is much simpler. I estimate about, some said it's about 60% more effective and easier to be in a treatment center. I don't know, but it's always much easier to fast in a group where time flies by, you have plenty of activities and nothing to prepare. You actually gain energy because you are freed from many tasks. You don't have to worry about many elements, and then you are in a secure environment accompanied. You can really let everything go. So to get back to the book, it will be published certainly this year. I don't know when, so I'm very happy. There will be a doctor who wrote an extraordinary preface. There will be a scoop. There will be a scoop about this preface. You will discover what it's about. I was very pleased with this preface. It's a doctor who did dry fasting and who will speak. So that's excellent. And then there are new things, new details. As I said, 200 pages. You will really have a very comprehensive book. Very interesting, with lots of contributions, lots of new things. There will be something for everyone, whether it's physical or spiritual. There will be plenty of new things. Biotherapies, we have new things, including what I talked to you about today. Yeah, this topic of therapeutic coverage. So a new discovery that I have been testing for 3 weeks with absolutely amazing and spectacular results on myself. In any case, a truly wonderful tool that the fasters will benefit from in April. So these are the new Pucma therapeutic covers, micronized multi-layer covers that I bring from Russia. So there are many copies, so be careful where they come from. So I have a reliable contact in Russia, and so it's a discovery for me that is really, she is spectacular, and really I had been looking for something like this for a long time actually, and it completely complements the other biotherapies we have, like Schumann's Ball Plateau, we have the Shi machine, we have energized sticks, we have plenty of things I've already talked about that are in the books. But this therapeutic cover, it brings yet another dimension. So you have a packaging, it's sold in a small suitcase like this. So all this is on my site for those interested in this product. You have it, you have 6 pages of explanations, there you go. So lots of scientific studies on this product, which is, for me, I won't say revolutionary, but not far off. which follows the evolution of humanity a bit, if you will. There was a small chapter on history, so it starts from William Reich, the Ark for Immortality, etc. So a really smart cover. So a micronized cover, 3 therapeutic layers, so it's very thick, and then you just wrap yourself in it, which is, I like it. It's the simplicity of the therapeutic. It's ultra simple. You don't have to consume dietary supplements. You don't have to do anything. You just have to wrap yourself up. I would say twice a day. The treatment lasts about 3 weeks, a month to complete a first cycle, let's say. I would say on average 2 times 20 minutes a day. If you want to push a little more, let's say 2 times 30, 40 minutes a day. That's what I do. I did that for 3 weeks. So it changes a lot of things in terms of energy fatigue. You do this after a workout, you wrap yourself in it, and you immediately feel the warmth coming into your body. So this therapy is completely revolutionary in the sense that we are luminous, energetic beings, we are emitting beings, receivers of energy, of information, and then this therapeutic blanket will simply reflect our own electromagnetism. So we have heat loss, we fall ill because we lose vitality, energy over the years, through illnesses, the hard knocks we've had, and we lose energy, so we become a bit more fragile, things settle in, and then this system actually restores all that. You put yourself in a kind of cocoon, your own energy, your own organs have a vibration, a frequency, and the therapeutic is a micronized layer. Actually, keep all your energy. There will be a reflection of your own electromagnetism, and you will retain your heat, accumulating it like an organ. So you will simultaneously restore all your systems, organs, tissues, the sound. There have been tests on sound analysis, so you boost your immune system, your white blood cells, your red blood cells, the entire metabolism is actually sublimated, making it a unique therapy. And then people who don't want to do dry fasting, well, very well, you can take an interest in this cover, you can really do great treatments. Or people I think of are those in the hospital who are in bad shape, who have pain everywhere. We have studies on pain reduction in hospitals, it's quite spectacular. Break time coverage that has been accredited by medical distinctions, the European Academy of Natural Sciences. There is an award. You have the Melchnikov Center, which has received, so this therapy has received a medal for a practical contribution to strengthening the nation's health. So very, very effective. So in broad terms, the key words: increase immunity, reduce inflammation and pain, decrease the side effects of other therapeutic methods. I am thinking in particular of chemotherapy. Someone who would undergo chemotherapy, I am not at all in favor of it, but someone who would have to do it, I would recommend doing coverage cycles. I would say 3 cycles of 30 minutes each per day would be ideal. It synchronizes the biorhythms, so we recover faster from jet lag. People who work at night, etc., can have a session whenever possible between work. Very good for recovery, harmonization of the autonomic nervous system. That's the strong point of this blanket. There are studies that have shown spectacular effects. So all very powerful neuropsychiatric diseases, depression, etc. Strengthening of tissues, organs, etc. Rehabilitates patients, the elderly and disabled people. Incurable patients, I like that word. So you have results in general. 82% improvement, 82% on respiratory system diseases, including everything related to bronchitis, asthma, people who keep getting better, who have chronic rates, asthma, bronchial problems, breathing problems, 82% improvement. It's spectacular. 76% on the digestive system, 58% on musculoskeletal diseases, 40% on metabolic and involutional diseases, 83% for cerebral syndromes and traumas, and 92% on all neurodisorders, nervous disorders, peripheral, and 86%, 96%, no, there you go, between French and Swiss, 86%, 96%, 86%, there you go, 86% for autonomic nervous system disorders, there you go. So very effective for all neurological disorders, depression, burnout, schizophrenia, everything that is neurological, psychiatric. You have the complete file on my website. Pain as well, improvement. It was done in a hospital, improvement of pain. Use of the therapeutic blanket allowed for a rapid improvement in the patient's condition with earlier and more significant pain relief, reducing the need for analgesics, etc., etc. You have all that on the website. There you go. So a very simple blanket to use 2 times 40 minutes. That's the maximum per day. Well, the other day I did almost an hour. It was a bit late in the evening. It was around 10 or 11 o'clock. I didn't fall asleep well because there was so much energy actually. So it actually restores your own vital energy. Vital energy is the crux of the matter. Without energy you can't do anything in life. So this system will correct energy deficits in your body. Quite interesting. Athletes too, it has been tested, research has been conducted for the rehabilitation of patients suffering from circulatory disorders, manifesting as latent autonomic lability or clinically manifested autonomic dysfunctions. A rehabilitation treatment covering 25 procedures, so 25 times, from 25 to 40 minutes have been tested. The treatment with the coverage leads to a significant and stable improvement in the condition of 83% of patients. No improvement or an unstable improvement was observed in 17% of patients. So here is the result. Treatment using therapeutic coverage leads to an objective reduction in autonomic abnormalities. It activates the body's protective capacity reserves and regulates psycho-emotional disturbances. For the treatment, a marked improvement was observed in 83% of cases, a slight improvement in 12%, and no improvement in 5%. So that's quite interesting. The following clinical neurological trends have been observed, so you will read it. Normalization in cases of hypotonia, dystonia, reduction of hyperkinesia, disappearance, etc. Increase in the number of active and passive movements for people with mobility issues. In some cases, physical functions that had disappeared due to illness were reacquired, such as sitting, walking, and using hands. Here are people who had significant mobility issues, reduction in the frequency and intensity of headaches, thus also improving sleep. Improvement in voluntary emotional state, better mood, behavior correction, normalization of sleep, as I mentioned. Correction of functional abnormalities of the nervous system, pain relief, etc. The effects obtained from the neural and somatic state. Confirm the targeted action of the treatment and the underlying pathogenic mechanisms of neurological diseases, thus very effective on neurological conditions. So there is a whole file on my website that you can read. So truly a therapy that creates, which can be used in prevention for one's health, people who want to maintain good health, people who have conditions, who are looking for a curative effect, and then in dry fasting can provide support in dry fasting. We have an exacerbation over the course of the passing days. The nervous system goes on alert, it's normal, and then we have fatigue that sets in day by day, and then this technology will precisely work on these 2 levels. So that's exactly what we're looking for. It will calm and then energize at the same time and actually restore all tissues and organs. That's exactly what we're looking for. It's what we call terrain therapy. It's a therapy that works on all systems, a truly generalist, global therapy, holistic, since we work on everything that is physical but also psycho-emotional by restoring our own electromagnetism, which has lost energy and fact. So there you go. I am very satisfied with this new discovery. In any case, I have tested it a lot after sports, so it's very effective. I feel in great shape, even though last night I went to bed a bit late. I didn't sleep much yet. I am in great shape. I did a session this morning when I got up, so I'm really making good use of this new object, absolutely interesting, and I would be really happy to see the fasters use it soon and to see a little bit of what it will bring with everything we already have. So fasting is already very powerful, very complete. We have a weapon. Therapeutic dry fasting is, for me, currently the most effective therapy you can find among all existing therapies, alternative ones. You have dry fasting as number one, despite everything that can be criticized about this method. We have the feedback, we have the results, we know what it does. So there you go. And then if you have found biotherapies that will help, it's a plus. So for those who want to go further, there are details on my website. In the shop you have the full description of this product. So I wish to see you soon for another video.